I actually one minute. Okay, I hope this be big enough to be seen by you. Over here is morning, but I think in Indonesia is afternoon. I have to say good afternoon. All right. So good afternoon to Indonesian and others. My name is Hossein. First, I saw you announce. Just I would like to correct some of about my biography you presented over in your slides. My postdoc is from Stockholm University of Sweden. Today, I would like to appreciate from the conference for inviting me as a speaker here, and especially my friend Dr. Anwar. He invited my old classmate, invited me to present in this conference. Today I would like to talk about the statistical modeling of COVID-19 infected population in Iran, and especially my Fars province. Over here I want to find some statistical models for COVID-19 infected population, the daily cases of each day, both in Iran and Fars province. Fars is my province, is one of the 31 provinces in Iran. Because I live here and it affects directly on my work, so I concentrate in this one. But the models you can extend in any other areas. This modeling, regardless of external parameters, include medication, changes in strategy of the government, number of the people in the contact, and so many other parameters. Clearly, the hypothesis and the multiplicity of the available parameters have important implications for our models. But these are just some basic modeling. It needs still many more development. The topics I am discussing here, theoretically, I have discussed with my colleagues in my books. You can find in my books. And also the programs I am using is NLR published by in CRAN, but currently it is archived. You cannot install directly in R, but you can get it in the archive of the R or my website. First, I show the data. This is the Iran case, daily infected new case at each date of the Iran. During the period, the first report they give in the 19th of January 2020. Even that time, there was very argue about that the COVID have comes to Iran, but they reported some days late. And in Fars province, they reported after almost 7 days, which I'm going to modeling over here. And I will study from the beginning until 16 September 2021, which means almost around 1 week ago. So the data every day are updating, modeling, and improving. As I said, Iran report has some delay. Then the first province outbreak of Iran was Qom. It's a south region in south of Tehran. They have many collaboration with China and religious cities, but they avoid to guarantee that to lock down the province and it spread overall in the future. The factor that will be shown in next slides, there are some many factors affecting on the effect of this rays and waves they coming. They are Iranian New Year. It has a huge effect on that. Iranian New Year start in the spring. It is almost in March. I will show later. And there are some religious ceremonies like Ramadan, Muharram, Safar. Then opening governments had effect. Opening a school at the autumn had effect. Also, president election in this year and Republic Day ceremonies. All of them because they didn't avoid any lockdown and they didn't obey any distance, so they causes many problems. These are the effects we see. So this is the daily cases in Iran. This is the cumulative dates. If we have suppose a waves comes, then it going down like this. In the cumulative curves, it shows like a concave up curve. going, and then it's going to be straight. But as you can see, if the spread of the virus want to stop, we must have in the cumulative a horizontal line. It goes to straightly horizontally. But again, another waves come and it started increasing, going up, up, up. Now this is the last waves. This is the mortality rate, the death rate in Iran. Also the cumulative curve. But over here, if you look at the mortality rate and the daily cases within the 100 to 200, look at this. This is the Iran data they have reported. It does not have any wave, but from the death rate, they report it has a wave over here. First, I was thinking maybe it's because the cumulatively they are sum up and they're here and increase, but I asked from the doctors, like my cousin is a doctor, I asked him and said the data report is wrong. So they are very argues in Europe about the government reporting wrong data. So in this modeling, this modeling of this daily diseases in Iran for me is not correct. So I'm not modeling that, but I tried to modeling this mortality rate. This is the problem. But the first province is more accurate. This is the first province. I'm going to model this. This is the daily new cases and also the cumulative. Again, we see the S shapes, which they are going to be stable after the wave. But again, we see many increases. I want to model these increases. Now I have zoomed this curve only first 20 days when the waves come. It could be controlled. I'm modeling first this one and discuss about what happened. And this is the mortality rate of Iran. This modeling I am using actually is some Gaussian models in some literature. Bench in 2020 they have developed this. They have added some stochastic parameters to their model, also variance heterogeneity stochastically again to their model. But I haven't done that, and in my model I have to do some correction. And also, like this, when we want to find these waves, we can use EM algorithm. This is the future I have to do. And introducing some nonlinear regression models. I am using, this is the logistic growth curve, general logistic growth curve. I have modified, and this is the last model over here I am using to describe the skewed curves. I'm using this one because some of them they are skewed. And for a skewed curve, this is a skewed type normal because it has, first I was using this one, but because it has integral inside, when I combining them with the other models, it causes some problem. Computational convergence is not easy to find the derivative and gradients of the parameters, so I'm avoiding this one. I'm using this growth logistic curve. And for symmetric model, as in the literature, I will make it bigger. I'm using this Gaussian, and this is the Gaussian with a vertical scale because sometimes we have a stable variation of the disease, so we might have some vertical scale also. I have added here. Now, I go to the first data for modeling. Here, this is the overall all. These marks are the events that happen and causes the wave. I want to discuss about this one. So let's zoom in the beginning. As you see, this is the beginning. These are mark 8 Iranian New Year after 30 days. And let's concentrate. This is all farce in my own city. This is first 20 days, the waves come and then it started. As I said, it was in Iranian was last month of the winter. When winter finish in Iran, we have 2 weeks holiday. So in this 2 weeks holiday, of course, everything is closed. It's a good time to do lockdown and control the virus. But the problem is people in the 2 weeks holiday, they all start traveling. In my city, for example, in Fars province, the center is Shiraz. The people travel from Tehran and other, like Qom, other cities to Shiraz. Before that is not much virus, but during these holidays, they didn't. Many people asked to lock down the city. They didn't lock down the cities, and they spread to Shiraz. Well, my working city is 4 hour times far from Shiraz, but it's just a working city. But during the weekends, I didn't travel, but many people travel far from here. They go to Shiraz, they get virus, and after the 2 weeks holiday, they come to my city. So 2 weeks is safe to do anything, but after 2 weeks, is a danger again to get the virus. We observe directly this what happened. So this is Iranian New Year at the 30th date. This is 8, and then it takes 2 weeks to finish these holidays. And after 2 weeks, this is, as you see, this is 30 days, 44, started another wave. And also government in this time, because they had a 1 month lockdown, everything we faced with many financial problem, they said, okay, the office workers should have a start job. And after that, again, we faced with some increase. Then they tried to control it. They did some more lockdown, but until Ramadan. Ramadan, they said, oh, it's a religious day. We have to do our ceremonies. They opened it again. In the middle of Ramadan, we say some increase again, some decline. And but in the Eid of Fitr, the last day of this is Muslim Eid, they opened everything. They said, we want to do the ceremonies, praise, and so on. And in the beginning, after every 2 weeks, we could see the effect. 2 weeks after Eid al-Fitr, you will see a very sharp increasing started. You see, it was very huge effect after Ramadan. It started, and we faced with some very outbreak. It was very problem. It takes 3 months again to control it. We faced with bankruptcy. Over here, I have a music school. The government announced me, you have to close it. I had many debts. So every time I was modeling it to announce my students, okay, this day is dangerous, don't come to a school. Another day, they ask us to close private classes, then do the public classes, and so on. So it directly affected on us, but we had to make a decision. So this is why I'm concentrating in my first province. After that, again, 2 months of another ceremonies of Iranians comes. I have marked this, and also the autumn comes. It was the opening of the schools, and then we faced with another very high outbreak again. And so far, after 2 years, we have this phase. So every of them, I'm going to find model for them. This one is skewed. I'm using logistic curve, and the others I'm using the Gaussian because they are symmetric. All of them are using the NLR program. These are the model definition. And this is the first one, the first 20 days of the wave in Fars province. These are the model. This one is just Gaussian. This is Gaussian with the vertical shift. I'm using this one, and for forecasting purpose, I was doing this in the beginning. Every day when the data comes, I put inside and do the model curve, and then we try to forecast from this model. We said that if the lockdown continues, in 6 days the infection could be declined completely. In 6 days they could control everything. And during this time, only 70 more people would be infected, and totally 114 people would get the disease. Using the forecast, government could calculate the cost of the lockdown and make decision about managing this situation and the cost as well. We know that the China have done same management. In that time, we see the China finish in 1 month. We expected this to happen here, but this not happened, and they didn't lock down completely, and the other waves comes. So we are going to combine all of them, aggregating all the models. 8 waves have been observed so far for Fars province in daily infected people. Modeling is performed with 3 approaches. The first is to separately fit model for each of the waves. We had 8 models. Then we internally sum some of them. I'm at this last 2 because this is a steady state during between the waves. We have some constant vibration of the virus, and then I sum 3 of them, 2 of them 1 times, and then 3 of them. This is one approach to get to the steady state, or use the vertical shift, and then merging them all of them together. These 3 of them, I have done the modified form of symmetric Gaussian with vertical shift, and modified of a generalist logistic model. The 5th wave was not symmetric, so I used the generalist logistic model, and the rest I used Gaussian model. Moreover, for forecasting purpose, we have different scenarios to managing as we see. At first, if we assume that the society again is going to be locked down again today, and stop the spreading of the virus, the Gaussian with vertical shift parameter is without vertical shift is fitted, and then we do the forecasting. And the second scenario is like before, if we don't lock down the cities and because the period of a steady statistic of patient, for this case again the shifted Gaussian we need with the vertical shift. But because in the end I will show, because this model they are summing, and the tails they are summed with each other, so we don't need to do to the second one. These are all of them fit 1 by 1. I have fitted, as you see, totally. This is the combination of 2 waves. Last 2 waves. This is merging 3 waves and sum over the model, and the final model. This is the final model with 26 parameters in a nonlinear form. I have used a nonlinear regression with robust methods actually, and this is the final fit. Now let's see how it fits. These are the models. 11 model totally nonlinear regression with the parameters. Let's see the fit, how it's going on, and how it forecasts the beginning. So I will zoom in this beginning area. The fifth one, it was the Gaussian. The first 3 one, because the first 3 one they are very close together. The third one have covered the first 2 one. These are the 2 waves in the beginning I have, and then I add up all of them together. The tails they are very close to each other, so it has covered it. Maybe a stochastic parameter I can add to remedy this one. And totally for forecasting purpose, in the end, look at this. Now we are in day 570, and if we do the forecast under 670, around 70 days from now, 2 months, still this curve will fix in 122. It's not going to 0 so soon until next 2 months. If this continues, now started vaccinating can decline it, but this from tomorrow the schools open, maybe it cause another waves, maybe another ceremonies. This is just theoretically, but if this lockdown continues until next 2 months, we have the fixed vibration of 120 patients. Hospitals have to be prepared for this, and totally still 22,000 people will be infected. As I explained, if they have been locked down the first 20 days, they could finish it in almost, how much I said, only a few people, but now still for today they have to face with 22,000 more patients. So this is the wrong decision about this matter, causes so many problems that we hope the lockdowns continue. And if we do exaggerating, and I continue to see when it's going to finish, of course this is not correct to do that, but just exaggerating model. I have drawn more 2 years, 1,200 more days, and it goes to 30 people per day. The result, of course, will be affected by some more external factors. And although the estimate is outside the range of the regression line, in the regression we are not allowed to do the forecasting outside our range of the data. But in nonlinear regression, it is okay. It works in a short time. It works. But however, if we want to do exaggerating for next 2 years, it goes to a steady state for 30 days, for 30% per day. People, it was for the first province. I will discuss here. As can be seen, first three models are covered into the third one because they are very close, and the thirds they cover up each other. Only the parameter estimate of the model 3 of the original fit was close to the final combination. More study is still required to add the stochastics, serially, and variance time-dependent stochastic should be added to the model, as in the literature. The mortality rate modeling can be forecast similarly. I will do it for Iran. For Iran data, due to wrong reporting, the model will not be correct, but with the zooming over last waves, maybe we can do just the last waves. The steady state after caused the virus to spread between the people, and if the society distance break by another religious ceremonies, a school opening will face with another huge wave. Every time new wave are larger than the previous one is very dangerous. At this time, all people are under first vaccination. After 1.5 months, we have to look at the data again and observe the event. We have fitted the data by smoothing spleen also. It's under study. There are a few solutions to find the change points in the Iran data I will show. EM algorithm, smoothing spleen, numerical derivative root finding, I will do for Iran. And if I want to do for Iran, this is the Iran data, this is the mortality rate. As I said, the Iran data is not correct, so I'll just concentrate on mortality rate. I will do some comparison between first province, the mortality rate. The green one is Iran. After day 300, see Iran and first is same. It shows again some problem even in the mortality rate, because the number of patients they report is high, but the mortality rate is low. So again, something is wrong reported over here. But anyway, if I do I have to find the inflection point. I do the numerical computation of the first and the second derivative. Over here we can see that when the derivative moves from negative to
so
positive.
You have 5 minutes to learn?
Okay, sure. In a few minutes I will finish. So these are the inflection points over here, 190. Around this area, it has some variation, and this point. All of them, these are the waves of Iran, again for each of them separately, but still when I add up them together, I cannot achieve the convergence. So I will stop here. Thank you very much for listening. I hope if later on, if you had any problem, I will be happy to answer.